Welcome to the Mind Myself podcast. I'm Esther, and it is my pleasure to be bringing you information about healthcare approaches, health issues, and people's health journey stories, all from the complementary, holistic, and integrative perspectives, helping you become your own best health advocate and helping you make your own informed choices because you matter. Welcome, Jonathan DeMonte. We're so glad to have you here on our Mind Myself podcast.
Thank you.
Excellent. So just refresh our listeners or our watchers today what your credentials are and what you bring to the table as we talk about what is Bowen Therapy.
Great. So my name is Jonathan, and I've been a Bowen Therapy practitioner officially since 2001, but I came across Bowen Therapy in the late 90s. And that was at the beginning stages of my career as a homeopath. And I had the fortune of being in a clinic where a person had taken Bowen Therapy training in the mid-90s. And it was very eye-opening to me to see that a physical therapy could be effective in conjunction with homeopathy. And of course, being a new homeopath, I thought homeopathy would fix the world. However, it really didn't. It really was there is a necessary use for physical therapy. So Bowen Therapy, as I mentioned, is a physical therapy. It is performed on a body. There are some interesting aspects to that, but it is essentially a physical therapy where you are working on muscles, tendons, nerves, fascia, and you are manipulating those in a very interesting manner. The interesting aspect about Bowen Therapy is that it's more of a hands-off treatment than a hands-on. The therapist will perform a series of maneuvers through or over those structures I mentioned and release a message to the tension, to the inflammation, to the injury, to let go that, or to switch off the way it's protecting itself, the way it's inflaming or guarding or calcifying or becoming taut and inflamed. In a way, it's an untherapy because it turns off what the body is doing to protect itself.
An untherapy, I like that.
And it really does switch off your nervous system. In fact, people will say it is the most relaxing body work they've ever experienced. And the reason for that is that the first couple of moves you do on a person switch you into this amazing parasympathetic relaxation response, where you're in sync with your breathing. Your body is just unfolding. In fact, you could just do that and give the person a few minutes to process. And that's the key with this therapy, is that you do give time between sets of maneuvers to allow the body to switch off, to allow the areas to deflame, to relax, to flow again. So whether it's fascia that needs to unfurl within your membranes, or whether it's a tendon that needs to let go and receive oxygenated blood, or a muscle, or a nerve to just let go of that inflamed protective state. You know, it's like your nerves are hanging on a cliff edge with fingernails, and the person just comes and doesn't move, and you just let go, and you don't fall. You just start to go into healing mode. And so for some people, it's the most profound experience. And what is common with Bowen Therapy is that you don't need a lot of endless sessions. So if you have a frozen shoulder, you go 3 to 5 times and it should be fixed. It's like, wow. How long? Yeah, I mean, how long does a tissue take to repair? How long do injured parts of our body take to repair? That's how long the treatment should last. So if it's an injury like that, a muscular tendinous injury, it's very quick. If it's a nerve inflammation, like in a sciatica, yeah, maybe it takes 2-3 sessions, but it won't be 2-3 months. It should be 2-3-4 days, most likely.
Wow, I wish I'd have known. I had frozen shoulder, and it took me about a year and a half of some treatments and regular exercise. And if I'd have known about Bowen Therapy at the time, I would have been there with bells on.
Yeah, you have to try it. I mean, you're in Toronto, aren't you?
No, I'm in just outside Vancouver, BC.
Oh, great. Well, there's lots of good practitioners in your neighborhood, so it's something to experience. Anyway, in the early 2000s, I got involved in teaching Bowen Therapy, and I'm still teaching Bowen Therapy. And it's a real passion to enable practitioners to learn it. And in fact, I've got an online video course where people can learn, and people have learned to do this in remote parts of the world without coming to a class. That's what's very remarkable, that they could actually learn reasonably well how to do it. Ideally, they should do it online and see or feel how it should be, but it's very intuitive and innate. You know, it's just nothing unusual about it. It's so simple. Another beautiful thing about it that's unusual is that the practitioner gives time, but the clothes can stay on because there's no rubbing of the skin. You don't need to expose the skin to put a needle in. You don't need to do anything. The muscles can be worked through your normal clothing.
So I have a question about that. So is your training for Bowen Therapy, is it just for practitioners, or could anybody who wants to learn this healing modality, could they come and take this, particularly online, and then apply it to themselves or apply it to their loved ones, or is it only practitioners?
Well, Tom Bowen, for whom the therapy is named, he felt it was a gift that was given to him. And he absolutely wanted everyone to experience that. And so the training is around the world, open to everyone. And in North America, Bowen Therapy is not a regulated therapy. And so anyone could actually practice Bowen Therapy, whether it's for a loved one who has chronic problems, or it's for a practitioner who does another modality and wants to have an extra couple of tools for working on different areas of the body, like the jaw or the tailbone or frozen shoulder, because it's very efficient. It's very, very efficient. That's one of its remarkable qualities, is its ease of use, number one. It's ease of receiving it, and then its reliability. It's really like that proverbial aspirin that's going to work or not, and you wouldn't keep repeating it if it doesn't. And in fact, it's so reliable, you could diagnose whether someone has further problems than Bodywork could manage by how well it works or not. So for example, the hip pain, if after 2 or 3 sessions hasn't changed or the treatment benefits aren't holding, that joint is compromised, most likely. And so you know right away that you don't need to keep doing it for the sake of trying to get the person better. You need to have an orthopedic advice. So it's very, very useful. And because the tool is so reliable, you have such a confidence in doing it. Even though when I first started, I felt such an imposter. I was like, I will say, I never intended to be a body worker. It was accidental. I learned it because a new clinic opened and I had patients that wanted it. And so I learned it. And I really essentially faked it till I made it, but it was so forgiving that they still got good results. And so, you know, further training refined me and refined me and refined me. But it's just a very, very simple mechanistic method. It's very systemized. And yet once you learn a system, you can then start to apply pragmatic choices to the use of it. And, you know, there are rules, but they're not rules, they're guides to make it most efficient for when you're beginning to learn it. But when you learn those tools, you can use them in wonderful ways that you never expected possible.
And so for people who, some people may go, wow, I want to do this. I want to take your workshops or whoever's, and I want to learn how to do this in my life. But there might be some people who go, oh, that's beyond me. I don't have time. I don't want this. What should they look for in a Bowen Therapy practitioner?
Experience. They should really get referrals, because there's no standardized governing body. It's not a regulated profession. So people do take varying degrees of training and practicums with working with qualified practitioners. And that said, whether you come from another modality, like a chiropractor taking the course, or just do Bowen Therapy, they'll mix it up with other things that they know. A massage therapist will have massage hands and will have to untrain those hands in order to do efficient maneuvers of the Bowen Therapy style. So there's no rule to who's a good practitioner. It's reputation and referral will be the best thing. And if I were inquiring where to get a good practitioner, I would go to bowencanada.ca and I would contact the ones that seem local and ask them how much experience they have. Not their philosophy, not their training, but how much experience. And that would tell a lot. And an initial session may vary, but you do want to make sure that they address your area of concern, because there is this ability in Bowen to treat the whole body in a relaxation model, but you also want your elbow that's bothering you to be addressed. And so they do want to make sure that the problem they're seeking help for is addressed.
Excellent. So as we wrap up, is there anything else you'd like to leave your listeners with today in terms of Bowen Therapy and how to get it or how it's good for you?
So if you are beating your head against the wall of other therapies, try Bowen Therapy, because it is the one therapy that is not trying to make you better. It's trying to take you out of guardedness and switch you into that natural healing that should take place. It's not, you can't force healing. You cannot work a structure into healing. You have to set the stage for it. You have to allow the body to let go the defensive mechanism of being on in protection to being off in healing. That's the most important element of Bowen Therapy.
Wow, and I think we could all use that in so many different areas of our lives.
Yeah.
Do we be on, or do we relax into the healing of our own bodies and our own wisdom? That's fantastic. Thank you so much for being here, Jonathan. And you can check out his information below and reach out if you'd like to find out more. Thank you again.
Thank you.
Thank you for being with us at the Mind Myself podcast today. We know that time is precious and you've spent some of your valuable time with us. We're grateful. If you would like to reach out to our guests directly, the information is below. And if you would like more from Mind Myself, that information is also below. Please visit our website and check out all the information about the different complementary, holistic, and integrative healthcare approaches, information about health issues, more podcasts, tons of blogs, and we even have a community page for you where you could reach out and tell your story safely, or you could ask questions and perhaps somebody else in the world is going through something similar to you. In any case, we're so glad you're with us, and we're doing this because you matter.